Assalamu alaikum guys, welcome back. So in this video I'm going to discuss about the various eye drops, the different class of drugs, which drugs are prescribed to which patients, and just to give you a brief idea about it, I'm not going to go into too much detail, but in my upcoming videos inshallah we can discuss about the treatment for different diseases. So let's first start with antibiotics. Now antibiotics contains different class of drugs. Let's first start with fluoroquinolones. Fluoroquinolones are very important in the field of ophthalmology. You must have seen moxifloxacin quite a lot. So moxifloxacin is a fluoroquinolone. Fluoroquinolone drugs has four generation: first generation, second, third, and fourth. In first generation, the drug norfloxacin is present, but it is not used currently, even in the oral form or in the eye drop topical form. But in the, just for information, the first generation contains norfloxacin. Second generation contains ofloxacin. Now ofloxacin has a good role in the field of ophthalmology in the topical, as a topical, because they are widely used, especially if a patient comes with a foreign body and you have removed the foreign body, it was in epithelium or in the stroma, superficial stroma. So now the patient does not have any infection, but you can prescribe a weak antibiotic just to as a prophylactic measure to prevent infections. Now ofloxacin is a good drug of choice, I would say. Now the various companies that prepare them are Oflalon, Exocin, and various others. So you can prescribe this drug 3 to 4 times a day for 1 week or even 10 days. So the third generation, it contains moxifloxacin and gamifloxacin. Now the moxifloxacin is very it is, you must have seen this drug in eye drops form, as a topical form. You must have seen it in your life sometime. Now moxifloxacin, the various companies that prepare them are Vegamox, iMox, Moxpin, Moxiopt, and Fortiflox. Various other companies also prepare them. So it's a good choice for you can say, if for post-op patient, the patient who has just undergone cataract surgery and you want to prevent any prophylactic infections, which is the post-op patients are prone to these infections. So in post-op patients, you better prescribe a moxifloxacin antibiotic along with the steroid. We'll come to that when we discuss steroids. And in fourth generation, levofloxacin and gatifloxacin are there. Now levofloxacin drugs and gatifloxacin, in topical form, I have not seen them very common, but yes, they are present. So depending upon the severity of infection, you can prescribe these two. Now let's come to steroids. Now steroids are brilliant, but at the same time they're very dangerous. If used for a long time, they can cause complications. Now the various steroids, if we start from the weakest, is fluoromethalone or loteprednol. They both are the same level, they are weak steroid, and the companies that prepare them are FML, Lotepred, and lots of others. Now the one stronger than them is dexamethasone. So if your symptoms are not controlled with fluoromethalone or loteprednol, you can jump to dexamethasone. Maxidex is company that prepare them, like Alcon company that prepares dexamethasone. And the strongest of all them is prednisolone, and one of the famous companies we know is Predfort. And this Predfort we do prescribe to post-op patients, phaco patients, cataract, or any other PPP patients, 1 hourly, 2 hourly, depending upon the inflammation. When I say 1 hour to 2 hourly, that means one dropped every 2 hours. So these are the steroids. Now keeping in mind, this depends on the patient. If a patient of, let's say, vernal keratoconjunctivitis allergy, he comes to you and he has redness, itching, watering of eye, but they are not so severe, and he has just complained of, let's say he's a 7-year-old or 8-year-old boy and it's his first time he's having this complaint since 1 month. So you don't need to jump to a stronger steroid. You can start with a fluoromethalone 3 times a day, 4 times a day. And the important thing about steroids is you have to taper it. After using it like 4 times a day, then you use it 3 times a day for 1 week, then 2 times a day for 1 week, then 1 times a day for 1 week. So this you have to taper it. This is very important about this. So patient of VKC, you can prescribe weak steroids, or if they are not controlled, then you can go to stronger steroid, or in later stages we can go for intratarsal steroid. That is basically we inject a steroid in the intratarsal, in the upper eyelid, in simple words, to control the symptom if they are not controlled with medicines. because prolong these giant papillae under the eyelids, and the rubbing of this with the cornea can cause corneal thinning and decrease in vision. Let's come to anti-allergic now. I gave the example of vernal keratoconjunctivitis, that is allergy. These patients need Olopatadine. Now Olopatadine is the generic formula. The companies that prepare them are iPat, Tenlop Fort, Ogate, and lots of others. So you need to give this 3 times a day, and you can give it for 1, 2, or even 3 months depending upon the symptoms. And with this you give a steroid. Now keeping in mind, try to give as less medicines to the patient, because the patient compliance depends on it. You try, I'll give you a challenge, try to instill 1 drop 3 times a day in your eyes for 1 week. It's really difficult. Your daily routine is affected with this, so try to give least steroids. What I mean is that if it can be controlled with 2, a mild steroid or anti-allergic, in this case you don't need to give artificial tears depending upon the symptoms, of course. You don't need to give artificial tears, that's what I meant, if he can be controlled with these 2. But yes, if it's a chronic problem, he needs it for dry eyes, you have to give artificial tears too. Let's come to the artificial tears. Speaking of which, the artificial tears, the generic formula is usually polyethylene glycol or hypercellulose. So these are tears that keep your eyes wet, they prevent it from dryness. Patients that need artificial tears are patients that have excessive screen time, that are sitting in front of the computers 10, 12, 15 hours a day, excessive mobile use, and people who are studying a lot. Because if you study or if you look at the screen for quite a long time, you tend, or you blink less. You just notice you blink less when you're looking at screens or when you're studying. So the dryness, then that causes excessive tearing in your eyes. So for that, either you blink, either you take gaps in between, or you instill artificial tear drops. Now artificial tear drops has no side effects. You can even use them for your lifetime. It is very good for those patients that want to get some topical medicine, although their eyes are fine, but they say, doctor, we need, like, it's a psychological thing, they need some topical medications to believe that now they have gotten some treatment. So you can give them artificial tears, they will be satisfied, and it won't cause any problems to them. You will be satisfied, so you can give this to them, and it does provide relief in majority of patients. Now let's come to antifungal. Before going to antifungal, I just want to say viral infections are at the top these days. Adenoviral infections, in which there is sudden onset of right eye or left eye, one eye, redness, swelling, watering, photophobia, itching. So these adenoviral infections, they usually resolve on their own, but you need to give weak antibiotics to prevent prophylactically, to prevent any infections. So viral infections, let's say viral conjunctivitis or bacterial conjunctivitis, their treatments are the same. In both you have to give antibiotic, and we give a steroid, and you can give an artificial tear. Now in bacterial infection, they will provide you quick relief, but in viral, since it's viral, it will spend its time 1 or 2 weeks, but we give this prophylactically to prevent superimposed infections. Now the one thing about viral is you need to tell the patient to wash his eyes with cold water. It will provide quick relief. Not to touch one eye and touch the other eye, because it can go from one eye to the other eye, and to separate his clothing or utensils at home, because it can spread very easily to other persons. Now let's come to antifungal. Now the treatment of fungal, bacterial, viral. The fungal only differs from that, we just add an antifungal in that. In antifungal, we also give antibacterial, and we give steroids, mild steroid, because most of the time a surgeon is not sure about whether it's bacterial and fungal, because the signs and symptoms, they overlap. So a good surgeon does start a patient of fungal ulcer on antibiotics as well. But in fungal, you have to give antifungal as well, and that is amphotericin B eye drops. But they do not come as a topical form. They need to be prepared from the bottles that are in the pharmacies. In some other video, I'll make a video on that too, inshallah, how to prepare them. So guys, I hope you got a brief idea. This is just to get you to know about the names, the various topical drops, which one is a strong one, which one is a weak one, when to give which drug. The proper treatment I did not discuss in this video in detail. If you want me to make a video in detail about any infection or any disease that is in your mind, please leave a comment, and I will try to make it in the future. Until my next video guys, take care.